A new team at Helen DeVos Children's Hospital is offering more help for kids with medically complex conditions and their families. Dr. Brad Hemker is part of the pediatric palliative care team, the only physician-led program of its kind in West Michigan. So thank you so much for joining us today.
Thank you for having me.
Why don't we start by explaining what kind of care we're talking about?
Sure. Palliative care is all about quality of life for kids with complex illness. So reducing suffering in those children and their families who are facing really complex, serious medical problems.
What kind of kids might be getting this care? Why might they be coming to Helen DeVos Children's Hospital?
I see kids all across the hospital with a variety of diagnoses. We don't treat any particular disease. It's more the fact that a child has a disease that we might be able to cure, but is going to be difficult to treat and have lots of symptoms and potentially progression as time goes on.
Why is it so important to offer pediatric palliative care? Because we know that Spectrum Health is the only health system in this area that actually has a program in place.
Sure. It's really about that suffering. It's making children's lives as good as they can be regardless of what they're facing. There's some fantastic things we can do in medicine, but often it has a cost, and we need to make sure that we're treating symptoms appropriately. And what our team does is try to help families and children with suffering, whether that's physical suffering. I deal a lot with pain and other worrisome symptoms, whether it's emotional suffering. I have social workers that work on more the psychosocial side and then the suffering from a family perspective and sibling perspective.
And this is a program, you're hitting about 1 year?
Yes.
At the end of this year?
Yes.
So how has it been going, and why start something like this in the first place at Spectrum Health? It's
been going very well. I think there's been a big need for a long time for this type of program, and I think the reason why is as this hospital here has grown, as the Children's Hospital has grown, and we see more and more complicated patients, it can offer wonderful services to kids in West Michigan. Those complexities come with additional problems, and this program is designed to support those families and support those complicated children, and that's why it's come around more recently.
So your program is not only doing well, it's actually growing too, which is a good thing.
It is. The team is myself and has been myself since January, but just today actually I have a nurse practitioner starting with me, kind of ironically, that will be joining the team from the medical perspective. I have a social worker / coordinator who's been helping with that role for the past month. So we finally have our core team set up. We also work with different people around the hospital, from child life, from the chaplain department, physical therapy, nutrition, just again trying to work as a team, as a comprehensive team, to improve these children's lives.
I know that you have been describing what pediatric palliative care is all about, but by this conversation, it's not always an end-of-life situation when you and someone from your team enters the picture. Can you explain a little bit?
Exactly. There's a lot of confusion about that. People assume palliative care means hospice and means end of life.
Yeah.
And they are vastly different things. My specialty is called hospice and palliative medicine, but the palliative medicine part, palliative care part, is really appropriate at any age and any stage of illness. In fact, the American Academy of Pediatrics recommends palliative care be incorporated for many illnesses at the time of diagnosis. And kids can have palliative care involved for years. I tell families all the time, as I'm meeting you now, and I'm hoping that in 20 years we're still having conversations about how to make your child's life as good as possible despite their challenges.
Yeah, and I know it's so big. Spectrum Health really goes at it with a team approach, and so having yourself and a nurse practitioner and all those other professionals within the walls of Spectrum Health is something that patients will receive when they go.
Absolutely. Though I think one of the great benefits of the program is we don't just see children at the hospital. So I get to know a lot of families when they're hospitalized, sometimes for months at a time. But I also see families and children in clinic, and so often in conjunction with other providers. Families will invite me and say, hey, can you come to my neurology appointment? Can you come to my pulmonary appointment? Because there's going to be some difficult conversations, and I want you and your team to be there to help us wade through those difficult decisions. And then one of my favorite parts of our program is we also offer home visits. So a little bit old-fashioned medicine, but I'm able to sit in families' homes several times a week often to help them not only deal with difficult symptoms, because there are many kids that I see that have difficult pain and other things that actually getting to clinic or getting to the hospital is difficult. So it doesn't make sense to me to make them come there if I'm trying to address those issues. So we'll go to the home to deal with some of that. But there's also something to be said about, as we're helping families sort through difficult medical decisions and putting all the pieces together, being in their own home, at their kitchen table, thinking through what makes most sense for my child. And my child's facing lots of different decisions. I could do a lot. We could do different options. What makes sense for our goals, for our worries, our concerns, for our family? Being in the home is an often much nicer way to discuss that with families.
Yeah, and that has to be really reassuring for the families that you work with.
I think it is. I think that support piece. One, families are very surprised by that, hey, we're willing to come to you to help you sort through what's best for your child and family. And I think over time, they realize the the value of this support for their child.
Yeah, well, you know, it's a situation where all families hope that they never have a young family member that ends up in the hospital, but it's good to know that that program is in place in case we do need that care.
Absolutely. I think that's what it's all about. It's not exactly what diagnosis the child has or what the prognosis is even. It's the fact that they're facing a difficult situation. And what we're working to do along with the other people at the hospital is make their life as good as possible.
Yeah, well, Dr. Hemker, we appreciate you being here today and explaining this a little bit. There you see some information on your screen. We'll also put it online if anybody has any questions. Yeah, thanks for coming in.
Great, thank you.
And happy Thanksgiving to you and your family. Yeah, we'll be right back with more White West. Don't go away.
Are you West?